So good afternoon.
Good afternoon.
So how you doing? How's your day? I hope it's great.
Yes, it's been very good. What about you?
I'm fine too. My name is Dr. Adam.
It's nice to meet you, Dr. Adam.
Yes, okay. I hope you're having a great time today.
Thank you, I am. I've really been enjoying the experiences this week.
Yeah, okay, so you're excited about it.
Yes, definitely.
Okay, that's splendid. So I have a patient before you here. Can you see him clearly?
Yes, I can.
Okay, yes, that's good. So is there anything you want to know about him?
Yes, okay, so what type of symptoms have you been experiencing recently that brings you here?
Yeah, yeah, that's a good question. So he has been experiencing headache,
Headache, okay.
fever. Yes, headache, fever,
Okay,
um, loss of appetite.
okay.
Um,
Has he been
and
having
he's have,
any breathing problems?
no, he doesn't have any breathing problems.
Okay. So no like respiratory things that are hurting, no sore throat, no runny nose, nothing like that?
Yeah, no sore throat, no runny nose.
Okay.
Yes.
Has he been experiencing any abdominal pain by any chance?
No, there's no abdominal pain.
Okay. So just a headache and a fever right now?
Headache, fever, is having loss of appetite,
Okay.
and yes, and then he's feeling like vomiting. That means he's having nausea. He's
Okay.
nauseated.
Does
Yes.
he work or live in an environment that is around mosquitoes a lot, do you think?
No.
So no mosquitoes or
Well, we're in Nigeria, which is Africa,
okay.
where mosquitoes are everywhere. In Nigeria,
Yes,
so so it's not like your place where I don't think you see mosquitoes around there. It's not a
Yeah.
breeding place. Yeah,
Okay.
but Africa it is. Because of the humidity. So you expect these kind of things around.
Yeah.
Yes.
Yeah, definitely.
Okay. Yes, you're doing well. You're doing well. Okay, go ahead.
Does he have any swelling in his legs by any chance?
No. It doesn't have any swellings. Man, I like your questions. You're trying to rule out other differentials, and that's good of you. Yes. So you sure you're showing me you're really a doctor.
Oh, thank you. I really
Yes,
enjoy
that
it.
means you're a okay. That means I can just give you the certificate now. Can I?
Yeah, okay. So from the symptoms
Okay. Yeah.
of like the
Yes.
headache and fever and loss of appetite, that seems to be malaria. So I would run just
Okay.
an RDT to see if that
Yeah.
tests positive. Do you have?
Yes. Yes, we have done the RDT for this patient and turned out to be positive.
Okay, so what I would recommend is prescribing him with the ACT, and I think that would be
Yeah.
a good treatment because that'll just work with his malaria, and it does not seem to be a complicated case of malaria, simply uncomplicated. So I think the ACT should be able to treat that. And then
Yes.
just in the future, I would probably work on trying to use bug spray if you can, or stay inside during dark just to try and prevent the possibility of getting bitten and getting malaria again. And there's also drugs that you can use if you want to prevent it in the future, but those are not necessary.
So that's good. That's good. You've given a good
Thank
diagnosis,
you.
treatment, prevention. No, that's excellent of you. I'm happy about that.
Thank
Sure,
you.
you've made my day actually. It's like you make me feel as if you're a doctor talking to me.
Oh,
Like a doctor
really?
trying to
Thank
diagnose
you.
me. Yes. No, that's great of you. You've tried so much. Yeah, so let me add something for you. Yes. Okay. You said ACT. Do you know the full meaning of ACT?
It's something combination therapy.
Yeah, artemisinin combination therapy. So what that means is that in the treatment of malaria, you don't do what we call monotherapy because you will not get treatment right, and the patient will still come back with symptoms again. So in the
Okay.
treatment of malaria these days is artemisinin combination therapy. That means you need to give two drugs. So in the treatment we gave the patient, we gave him artemether and lumefantrine. So these are
Okay.
combination therapy, isn't
Okay.
it? So we give artemether, lumefantrine, and there are different brands of artemether lumefantrine out there in the market.
Okay.
So you could just give any that that works for the patient. So we gave the patient artemether lumefantrine,
Okay.
And the brand name is Quatem. I know you've come across Quatem. Quatem, it's from one of the pharmaceutical companies like Novartis,
Hmm.
and the patient has improved and he's doing well now because I've interacted with him before I just talked to you.
Oh,
So and he's
awesome.
doing great. Yes, and he's doing great. And then and of course, when you talk about prevention, the preventive measures that you have to put in place apart from staying indoors,
Hmm.
you did talk about the mosquito insecticide treated nets.
I don't think I did, but that is important. Yes.
Yes. Yes. And then okay, mosquitoes thrive in swampy areas, for their breeding.
Yes.
Anywhere there's stagnant water, you find that mosquitoes breed there. So you have to clear, remove stagnant water, clear the bushes around, you
Hmm.
know. Yes, sleep in insecticide treated net. You could
Yep.
even have some insecticide, to spray your room or the whole, where you sleep and all that. So at
Yes.
least mosquitoes. You have a lot of mosquitoes in Nigeria.
Hmm.
So and then you're talking about one of the prophylaxis. Sometimes you can give prophylaxis for malaria. Most
Okay.
especially like you now coming to my country now. I have to
Uh-huh.
give you prophylactic anti-malaria because I definitely, if you
Okay.
just come like that,
Oh,
it's,
so.
it's going to be different from someone in Nigeria that gets malaria.
Oh, okay. Yeah, that makes sense. That
Yes,
makes sense.
yes. So, okay, do you know any prophylactic anti-malaria that you can give your patients?
Um, I do not know.
Okay. There's so many of them. You could give there's what we call sulfadoxine pyrimethamine,
Okay.
marketed as Fansida, sulfadoxine pyrimethamine. You can give it to your patients,
Okay.
for prophylaxis. Yes.
Yeah.
So, and then you can give them mefloquine, you can give them doxycycline, proguanil. All these are prophylactic medications for malaria, but they are not absolute, you know, drugs
Yeah,
for
definitely.
prophylaxis. Yes, yes, yes. But like for you that you're going to travel down to Africa, definitely.
Definitely,
When you
yeah.
talk about travel medicine, you'll be asked where are you traveling to, and they want to find out, okay, are you going to a malaria endemic area? So definitely they will have to give
Mm.
you prophylactic malaria. Try your
Yeah,
stay in
definitely.
the country before you come back. Okay?
Okay.
So you've really tried so much, As I said earlier, you've made my day because
Oh, thank you so
you went
much.
around asking, yes, you went around asking other questions. There's zero to call differential diagnosis because a patient comes to you, you don't think of one thing, you make your mind broad,
Uh-huh,
you
yeah.
think of other things, then finally you coin down to your diagnosis. The most important thing is to get to the diagnosis and then you make your treatment. So
Yes.
you've done an excellent job. Okay,
Thank you
so
so
keep it
much.
up.
It was very nice talking to
Well
you.
done.
Thank you.
Yeah, have a blissful time. Bye for now.
All right. Thank you.